Hi, Barry here from BackPain 360. Today I wanted to talk about frontal plane range of motion, and that's the ability of our bodies to be able to side bend laterally left and right. Now what we found in terms of research was people who had a restriction side bending maybe one way or another had a direct correlation to the increase in their back pain. So if some people found that they could side bend one way maybe to their left but couldn't to their right, then we could then direct our stretches or our therapy or whatever that we needed to create mobility in that side of the body to reduce down their back pain on that area. Something that you can do at home, or if you're in a clinic yourself, you can test patients with this. It's a really simple test. If you lean against a wall, you've got your shoulders against the wall in this position, you're shoulder width apart with your feet, and you're stepping out from the wall approximately about 10 inches or so. If you place your hands flat down by your sides and then just laterally side bend over to your left first of all, but all the time keeping your shoulder in contact with the wall. So you're flat all the time as you go over. Don't let the shoulder roll forward. Once you get to that, as far as you feel you can, pain free, take a mental note of how far you got. For me, it's just to the side of my left knee. And as I come back up, I'll then test the opposite side, and I may have a restriction, or I might be able to get as far on that side, and then I'll take a mental note of that. Now, for instance, if someone is restricted going over to their right, there's two things that can happen. It's because they've got a tightening or restriction possibly in the soft tissue on their left, which is holding them or not facilitating that range of motion. Or they have a restriction on their right side, which is usually a bony anomaly, scar tissue, some previous injury in the actual spine itself, and it stops them or prevents them going any further. But you can actually treat that in terms of stretching, so we can see if we can influence that range of motion in that frontal plane. So once again, we're going to stand shoulder width apart, but this time we're going to place our hands above our head. Now in this position, I like to interweave my fingers or hold the hands together just so they're not waving around. But as they're in this position and my head is between my two arms, so it's not in front and not behind, I then push my hip, for instance, to the left. So it will go as far over to the left as I can, and then I start my side bend, which will be going in this movement here. Now as I go over to the end range, I'll naturally come to an end. And I feel like I can't go any further, but what if I take in a deep breath and then exhale, I'll feel I've got about 3, maybe 5% extra range of motion, and that's the stretch we're looking for. That's that ligamentous fascial stretch that we really like to kind of get those tissues through that range of motion. So initially we'll have all our proprioceptors, our nerve endings saying, I can't go any further here, there's no way you're going to push me any further. But if you actually use your breath to exhale, you'll actually find out that you've got that extra range of motion. And that's what we're going after. It's that last kind of 3 to 5%. That's the real kind of money there, because that's the stretch that we're trying to access and give us our window into those tissues. You can do the exact same going the other way if your restriction is on both sides or even just on that side. Push your hip as far as it will go over to the opposite way, hands above your head, side bend over, go as far as you feel you can. Hit that end range. Once again, you're going to make sure it's not painful. Deep breath in, breath out, and ease into the stretch just a little bit further. And I like to take about anything between 3 and 6 seconds just to see if those tissues will open up a little bit. I also like to do those exercises if they're trying to mobilize a tissue or stretch out a restricted area, 6 on each side. And I would do those possibly initially just twice a day. So I would do 6 in the morning when I'm up moving around and I'm nice and warmed up, and 6 in the evening just before I kind of sit down for the evening. And that gives me my maximum end range of motion, and then I can use that over the kind of coming weeks and tend to kind of see if that area opens up a little bit further. And the nice thing is you learned how to retest it, so you can then in a couple of days time check your lateral side bend and see if you're increasing it, or once again if you're a clinician, if your patients are able to get into that side bend a little bit easier. So see how you get on. Any kind of feedback or comments, really appreciate it. Pop it in the comments below, and hopefully I'll catch you on the next one.